Hey guys, thanks for joining the chat. The purpose of this chat is just to get some insight from current sports residents in physical therapy and kind of hear about different factors that they went through to choose their respective residencies and help future applicants. So let's go ahead and just start by going around the table and introducing ourselves, starting with Joe.
My name is Joe Micca. I am the sports resident at UPMC Sports Medicine in Pittsburgh, Pennsylvania.
Mike?
My name is Michael Sclafini. I am a sports PT resident at the Cleveland Clinic.
Chelsea?
My name is Chelsea Davis. I am sports resident at Ohio State University.
And Sean?
I'm Sean Bardenett. I am the sports PT resident at Ben Hogan. I work with TCU Athletics down in Texas.
And I'm Brian Schwabe. I'm a USC sports physical therapy resident. So, let's go through just a couple questions on, kind of the factors that made you choose your respective residencies. There's a lot of different components in sports physical therapy residencies, that we got on-field research, game coverage, faculty. There's a lot of different components. So, kind of what made you choose your own prospective residencies, and what were the decision factors?
All right. To start, there was a few things I wanted to make sure that I got out of my experience after going on many different interviews and seeing what each program had. I wanted my experience to have a lot of on-field and a lot of on-field coverage, in addition to a staff which I can not only get along with, but I can learn a lot from. Not as heavily based in research as some other places, but at least had a little bit in that component, as well as teaching. And in Pittsburgh here, I was able to spend an entire season with an NFL football team, and that's what I wanted to do. And this was one of the few that had that option, and that's why I ultimately chose it.
Yeah, I'll kind of piggyback off what Joe said is that, when you go through the interviews, you're kind of figuring out what parts of the different programs you like and maybe which areas are stronger. And one of the things that I like about the Cleveland Clinic is that you kind of hit all three levels. So we hit the high school, the collegiate, and the professional level. And, I'm going to have the opportunity to work with all three of the pro sports that are here in Cleveland, which was important to me because that way I could kind of get a feel for what each different professional college and high school level had to offer, and maybe kind of differentiate between what things I liked about that level versus some of the other levels.
Chelsea?
So I was really looking for a residency that had pretty equal experiences with research on the field, in the clinic, and then teaching. And I found that Ohio State really just had a really good experience in all of those areas. So ultimately, that's what kind of swayed me towards that residency. And I've been really enjoying the teaching component because that's very heavy in my residency.
How about you, Sean?
Yeah, to kind of piggyback off of what you guys have said, I was all over the country on interviews, and I really wanted that sports component. I wanted Division I or professional, and I got that. The mentoring component for me was really important. I have a lot of leeway with my current residency, a lot of time to get mentored. I'm not treating a full caseload even close to 40 hours a week. I think I spend 15 hours a week in clinic care on my own, so that was really important for me. The teaching and research component were also things that I was interested in, and the program I'm in now, like I said, kind of allows me to make the residency what I want of my own. So if that's my focus, I can kind of do that and kind of shift my time and put it to where I want to be. So I guess that's the reason I ended up here.
Kind of lost your face there for a while. I don't know if that happened on all the broadcasts, but we heard your audio, which is most important. I think for me, it was kind of a blend between everything everyone said. Similar to what Michael had to say was, the USC's residency kind of hits all three levels of competition, which I think is a unique blend as well. It's kind of nice to see the athletes go from the high school to the college to the professional ranks, and not only treat them just on the field or in the training room, but also in the clinic. And that's one of the components I was kind of looking for was every single level and being involved with the university because you get to use all their resources as well as their faculty and just getting a wide variety of everything from research to on the field experience and educational component along the way. So it sounds like everyone has like a different perspective on what they're looking for, and I think that's what makes sports residency so great. Is there's so many unique options along the way. So there's really a good fit for pretty much anyone. Another question is, what made you choose sports versus ortho? I think we get this a lot, especially us all individually. We get a lot of questions from current and future applicants on, what's the difference between sports and ortho, and why'd you do sports versus ortho, and I think it would be nice to kind of touch base on what made you decide between that, and specifically what kind of future goals do you have that assisted you in choosing a sports residency over an orthopedic residency.
Yeah, so in my particular residency, I work real closely with the ortho residents and the other residents, the women's health residents and the geriatric resident and the neuro residents. So I kind of see what they're all doing, and I take a lot of my didactic coursework with the ortho resident, and it's a lot of the same things there. So we go down joint by joint, learning right alongside the ortho resident, but where we start to go in a different direction as sport residents is we start to get that acute management, and that's kind of what I wanted to get out of this residency. So, we get on the field with our mentors, and they walk us through a situation and kind of go from there. And that's kind of where my goals in terms of where I wanted to do in my career down the road is to work, in college or pro sports and be able to manage those situations effectively. And that's why I ultimately chose the sports over an ortho.
Mike?
Yeah, so similar to what Joe was talking about, there's a lot of overlap between ortho and sports residencies, and I think the biggest thing that Joe mentioned was about the acute management and on the field, the sideline, everything like that. But then also the return to play, that end stage rehab. That's something that I really wanted is not to just be able to do go up and down stairs, but what are the physical demands of each sport, and so kind of preparing them for that, and plus you get a different exposure to different settings and varieties and things like that that you might not see in orthopedic orthopedic residency.
I would say that my residency, I didn't really know this going in, but it does work really closely with our ortho residents, and we actually share all the same didactic information. I never really considered doing an ortho residency. I'd always wanted to do sports. I knew that from the get-go because I did want that on the field management and seeing that full spectrum from getting injured, seeing them in the clinic, and then returning them to play. So I definitely wanted that aspect of it, and it was never really a question for me. It is interesting when people come in and don't really know which way to go, whether they should do ortho or sports. And I would say that if you're really on the fence, that finding a program that does work really closely with the other residents is a good opportunity to learn a little bit of both, and then you can just emphasize whichever one that you really want to do.
Yeah, for me, I think it was kind of just following what I was most passionate about. I think it's easier to be successful doing something you really enjoy, and for me it was, playing sports growing up, really understanding the demands of the sport, kind of like what Mike talked about. I think that's really important in your rehab to make sure that you're putting the athlete through what they're going to have to be facing, once they return to play. So I think it's important though for, someone in that position, but choosing between ortho or sports, to understand that if you think of when sports are played, that's when everyone else is not working, so nights and weekends. So I mean, I've been on the football field in the athletic training room for baseball, till midnight on a Saturday night. It is what it is, but I think that's important to understand the demands of it. But for me, when work doesn't feel like work, that's really a good feeling because you really have to love it. So for me, it was just kind of following what I'm most passionate about.
Yeah, no, I agree. I think I kind of agree with Chelsea that for me it was always sports the whole time. I think my background as a strength and conditioning coach beforehand kind of gave me a foundation for sports physical therapy and gave me a little bit more of a controlled interest in sports. But we got to remember that orthopedic is the foundation for any sports physical therapist. So, I think having that curriculum of both ortho and sports is really important. And USC does a really nice job of that. At least here at USC, we kind of do orthopedic didactic work and sports didactic work. So we intermix with the orthopedic residents, just similar to some of you other guys. And I think that's important, and it kind of gives you a good taste of both. More importantly, though, I think what made me kind of decide sports versus ortho was more the biomechanics behind different return to play criteria and different athletes, and they're just a whole other animal to treat sometimes. And in some ways they're easier, in some ways they're a lot harder. And I think that that training room experience kind of gives you just a good foundation for being comfortable treating an athlete. So I think I think we all have similar residency experiences, but very different ones at the same time. So I think what would be nice for some of the viewers would be to kind of describe a typical week for each one of your respective residencies. We're all kind of scattered throughout the country, and each one of ours are a little bit different. So I think it would be something kind of beneficial for them to hear. Joe, why don't you go ahead and start us off with that?
Sure. So a typical week for me, to start on Monday, is I was paired up with a primary care physician that works with us in the office. So I got paired with one of them when I first got here, and also a surgeon. And I spent some time with them on Monday mornings. And then I go into, I teach at the University of Pittsburgh in their entry-level musculoskeletal class. So Monday afternoons, I go and teach there, and then I come back to the clinic and do some afternoon hours to treat kind of the athletes that can't come in during the day, and their schedule only fits in the afternoon or in late and early evening. So I'll treat them there at the end of the day on Monday. Tuesday, typical day, is kind of my long day in the clinic. That's pretty much all I'm doing. Wednesday, I treat in the mornings. Then right now I go to the Pitt baseball team. I help out with them, and then I go back to teach class in that same musculoskeletal course. And that's it for a Wednesday. Thursday, we have sports grand rounds in the morning, and then I'm off to the clinic for a while, and then we do all the post-op athletes at Carnegie Mellon University, and we're treating all their post-op stuff, and I'm there all Thursday afternoon. Fridays, I'm treating in the morning, and then I'm off to Pitt physical therapy grand rounds. And then Fridays are usually a day of my didactic coursework. So whatever joint we may be on or whatever we're doing in class that day, Friday afternoon is typically when we do that. Saturday, depending on what's going on, what continuing education I got going on, is when we usually do that. If I'm covering a training room. In the fall, we had injury clinics, so if a high school athlete got injured, UPMC covers them to come in, and we kind of triage them as PTs and kind of send them their respective ways. That's kind of how it's gone so far. Come here at the end of April is when I start with the Steelers, so things are going to get a little hectic, and my schedule is going to be completely different, but that's kind of how it's going now.
How about you, Mike?
So my Mondays start off every morning. I have 4 hours that's dedicated to nothing but research within the sports medicine field. It's kind of like my own independent research time. I'm working on an IRB study for looking at collegiate rugby players. I'm doing a couple case reports, things like that. It's just kind of a time to just do more of that. And then I usually treat and mentor with some of the guys in our sports health clinic. And then Tuesdays we have a radiology conference where the sports medicine fellows, the MD fellows, will present their cases and then talk about the radiology findings. And then Tuesday morning I treat in the clinic and then go to, I'm the team physical therapist for John Carroll University right now. So, so I go there every Tuesday and Wednesday afternoon, and then Wednesday treat in the clinic, Wednesday John Carroll training room, Thursday is usually lecture day, as well as treating pretty much all day in the sports health center. Friday we have, similar to what Joe was talking about, we have a sports medicine fellows conference, so that's every Friday morning, and then I treat in the clinic Friday morning, and then usually have the rest of the weekend for game coverage. So like right now, I'm working with a high school lacrosse team, John Carroll University lacrosse, and then a collegiate rugby team as well in the Cleveland area. So it just kind of depends on what season it is and when those games fall.
Very cool. How about you, Chelsea?
So Mondays I start off in the clinic and then leave midday to go teach the ortho lab for the PT students, first year students, and then come back and treat some more. Tuesday I'll be all day in the clinic and then go cover rugby practice afterwards. And then Wednesday I go to the clinic and then leave for teaching again, go back to the clinic, and then go out to practice again for rugby. Thursday, again, most of the days spent in the clinic. I usually carve out some time that day for research to work on a research project. As a part of OSU's residency, you can either do research or case study as your scholarly project. So I've chosen to do some research with FAI. And then I'll go back and treat some more and then cover rugby practice again. So practices are Tuesday, Wednesday, and Thursday. Friday morning is when we have our didactic coursework, and both ortho and sports each has an hour. So whether that be the residents presenting or the faculty presenting, it'll be 2 hours there, and then treat the rest of the day in the clinic. And then the games on the weekend for rugby, typically, depending on the season again, how my is laid out.
Yeah, I realize this is kind of a tough question because their schedules change so much.
Yeah.
How about you, Sean?
Yeah, my day is kind of split in two, I feel like. In the first part of the day, I'm at TCU in the athletic training room from usually 8 to 12 or so, kind of helping as part of the medical team there. So whatever the physicians and the athletic trainers need, sometimes we're helping out with longer-term rehab, sometimes we're helping out with more acute cases. Pretty much whatever walks in the door, we're treating that. Then Monday afternoon, I'm in the clinic. I have my own caseload until, as long as that may take, Monday night. Tuesday, pretty similar. I start at TCU in the morning, same exact thing, and then Tuesday afternoon, that's my mentoring time with one of the physical therapists in the clinic. Usually my mentor, I kind of split the year, 6 months with one, 6 months with another, so I see some different perspectives, and we just co-treat their caseload. Wednesday, I teach at a local PT program in the morning, and then I come into clinic in the afternoon for my own caseload. And if there's games throughout the week, usually I'll sneak out of patient care and head and try and be in the dugout or on field for those as they come and go. Thursday, I'm back at TCU in the morning, 8 to 12, and then that Thursday afternoon is kind of my time to catch up on my research, to see surgeries, to shadow physicians in our office, kind of whatever I want to do. A lot of times I spend it working on my research or kind of shadowing a doctor. Friday, similar to what everyone has said, in the morning is our didactic time, so we're taking those classes. And then Friday afternoon, we're usually heading back up to TCU to prepare for whatever games they have that weekend. So helping out in the athletic training room, whatever they need us to do. Saturday, Sunday depends on games. If there's a football game, we can be there 7 to 7 or whenever that game is. And then the same thing for Sunday with some of these basketball or baseball, some of those games. So it's pretty variable, but that's a typical week for me, I'd say.
That's good. Mine's a little different, I think, because our curriculum is pretty much front-loaded. We go through 2 sports seminars for 4 days each, and then we have 2 orthopedic seminars, which are 8 days each. Like that's all you do all day for those 8 days, and we have 2 of those. So, Our didactic work in the beginning is pretty front-loaded, and the rest of the year we just do literature reviews with the orthopedic residents. So my schedule is a little different depending on didactic work and lit reviews. But Mondays are typically in the clinic for a few hours, and the high school training room in the afternoons, covering pretty much all the sports and any injury that kind of walks through the door, kind of similar to what Sean said. Tuesdays are typically MD rounds, and those are upstairs with the Curly Job docs, which are the team physicians for all the professional teams in LA. And then later that night, we go to USC for a literature review. So the first half of this residency was mainly with the ortho residents, going over just the orthopedic literature. And now we kind of do both. We do orthopedic and the sports literature reviews. So that's kind of it's kind of different depending on that, because those change times, and the MD rounds change times too, because we kind of switch from doctor to doctor to doctor depending on the time they're available, and if they have to go to certain games or cover their own teams. So that's pretty much Tuesdays. We have a little bit of a chunk of time in between on Tuesdays or in the afternoon, which you can use for anything from research to shadowing to just doing extra work. Typically, I like to use that for just catching up on research or spending my time with either the baseball guys or the basketball guys. So at the local college. On Wednesdays, that's my long day, kind of similar to what Joe said. I'm in the clinic in the morning through the afternoon, and then the rest of the afternoon through the night I'm at the local college treating in the training room. And I think that's probably been one of the better experiences, just because you have a lot of hands-on experience, and I'm fortunate that the athletic trainer just pretty much gives me free reign. So I could be there anywhere from 1 to 5 or 1 to 10, especially if there's a game that night. Thursdays are a little different. Thursdays I have clinic just during that day, but it's not for the full day, so I can use that additional time to cover extra events or go shadow other PTs, whether it be at USC or we have a USC faculty member who works for the Angels now, so I had an opportunity to go do that, or just a bunch of different random things that come up. Like last week I think we had this ESPN Sports Science show that we got to cover, so it's just little things that come up. You can kind of pick and choose, making your own schedule. Fridays are typically mentor day in the clinic, so those are for a few hours treating patients with your mentor. And later that night, if there's a game at the high school, we cover that. And then Saturdays I work in the clinic early in the morning, and then cover the college later at night. Again, that all changes depending on the season. Right now it's just baseball and track and field for the most part. And then pretty soon, kind of similar to Joe, I'll start working with some of the professional teams, the Sparks and the LA Kiss. So it depends on the season, just like everyone else. And the schedule's pretty hectic for those 6 weeks, like everyone kind of talked about. Kind of playing off that question, though, what kind of opportunities or special, unique experiences have you guys had so far, whether it be Joe with the Steelers or anything else that you guys kind of have or will have in the future with the rest of the residency coming up?
Really, it began. We have a real obviously at UPMC we have a really close relationship with the University of Pittsburgh. So not a lot of what's good about the residency is I can kind of tool it the way I want it to. Since there's 2 of us sports residents, my other colleague, the other resident with me, she kind of has a different interest in things like golf and volleyball, because that's what she did. So she was kind of headed that way. I kind of talked to my director, and she got me in. So I worked a little bit with the Pitt football team in addition to the Carnegie Mellon football team when I first started. Again, I'm with the Pitt baseball team now. And these are not, built into my residency, but these are the opportunities that kind of are there. It's just you got to go out and get them. The Steelers thing is built into the residency, and that's kind of so the actual course component and research component of my residency is just about over here now in March, because once I start in April with the Steelers, then that's kind of my responsibility. My clinic time's cut down quite a bit, and the Steelers is kind of my job from here on out. So, like I said, all these residencies are different, and what I like about mine is I made it how I want it, and that's what it sounds like a lot of you guys are doing.
Very cool. Very, very cool. That'll be fun. How about you, Mike? Anything unique?
So kind of what Joe was saying is, you know, you go into the residency and you kind of tweak it to what you're interested in. And so, you know, I picked up a couple electives, kind of like what Joe was talking about. You know, I'm really interested in collegiate athletics, so they were able to build in an extra afternoon that I go out to the John Carroll training room, and which has been awesome. And then we get the experience of 3 different pro sports, kind of, which sounds like a couple of you guys do as well. So, which is really nice because then, you know, you get it kind of mixes it up a little bit, and you kind of get the experience for that particular competition, and you kind of get a feel for what you like and what you don't like about each level. And you know, that I think that's huge. That when you get out of the sports residency, you kind of have a better understanding of where you'd like to go, and maybe what level you'd like to work with, and everything like that. So I think, you know, a lot of the programs are flexible, but I was really happy with the way Cleveland Clinic was flexible and gave me the opportunity to work with a couple different levels.
Very cool. What professional teams you're working with? I know you mentioned those 3.
I've already finished my rotation with the Cleveland Cavaliers, and then this summer I'll be working with the Indians, and then the Browns later on. So
Very cool.
it'll be all 3 different sports and all the 3 pro teams in Cleveland.
Nice. Very cool. How about you, Chelsea?
Well, there's a new part of our residency that just started this year, and actually I'm currently doing this right now. So for 4 weeks, we're over with OSU, Ohio State Athletics, with the PT, there's one PT who is employed by OSU Athletics, which is separate from OSU Sports Medicine. So the 2 residents go over and we basically learn how to function as a PT in a large Division I university. So it's been really fun. It is a newer position. They have, I think Kristen's been there for about 2 years now, so they're still kind of learning the reins. And we also spend some time with strength and conditioning and the doctors that treat the athletes, and then also in the training room working with athletic trainers. So we kind of see full picture, how everything works together. So it's been a really good experience, about halfway through now. So we have 2 more weeks and learning a ton, and it's been really kind of eye-opening, kind of learning how to function in that environment, because it can be a little tricky sometimes.
It's flying by too.
Yeah. Also, as a part at Ohio State, they just credentialed the first upper extremity fellowship. So some of my mentors are involved with the fellowship. So our mentors rotate basically every semester. We have a primary and a secondary. And the baseball fellowship, the mentor there, he'll be my mentor for this upcoming one, as well as the fellow. So kind of some unique experiences, get a little bit more with baseball with that. And then I'd say that I really like the way that they set up the mentoring, because it does rotate, and there's about 10 different people that you're going to be working with, kind of changing off and learning different things, because they're all experts in their own field and their own niche. So that'd be the special things I would say about Ohio State.
How about you, Sean?
Yeah, similar to Chelsea, I think one of the components of our residency here is the Division I athletics exposure. I'm there every day. Their athletic trainers are great about incorporating us, making us part of the team, and being on the field. All those opportunities at a big time university, Big 12 university, that I really am enjoying probably the most, I'd say, out of anything. Another thing, at our clinic, I guess we have a little bit of a focus on the now anywhere high school, college, up to that. So we do a lot of data analysis with that. We're pretty involved with UCL research, and we have kind of internationally.
I think we're losing you.
They're out working with a team out there. So I've gotten a lot of baseball exposure. We also have a lot of ACL studies going on, and the Division I component on a daily basis. I'd say those are the big things.
Yeah, I think we lost you for a little bit in that chunk in the middle there, but Right before that baseball thing, I don't know what you mentioned. Can you repeat that part?
So the kind of the focus of our clinic, I'd say we see a lot of overhead athletes. Did you hear that part?
No, we didn't. So overhead athletes,
Players.
Yeah.
Can you hear me?
Yeah, now we can.
Okay. Yeah, and we use a 3D motion analysis system, working on a lot of UCL research, things like that. And then we've had the opportunity to go out to spring training last week and spend some time out there. So a lot of baseball focus and the Division I component.
Nice. I think when I came into USC's residency, I think from my perspective, I kind of knew what was laid out. I knew that I would get every level, the local high schools, the college, and the professional with the Sparks. But what I didn't know was some of just the random things that come up along the year. You know, for example, in the fall, I was able to cover a pro volleyball tournament on the beach. I got to cover the NFL Players Association College Bowl, which was an awesome experience. Just get a little bit more of that high-level college experience. I got to also, similar to what Sean did, go down to help cover the spring training with the Angels. We're lucky that one of our USC grads is the head physical therapist there, so we got to go down for a couple weekends and help out with that. I think the other thing that's kind of unique is the extra mentoring that we get. If we want to build in additional mentoring experiences, we can kind of structure that. And similar to what Chelsea was saying about having multiple different mentors, we definitely do have different mentors. We have everyone from the clinic mentors, which is 3 of them, to some of the USC faculty coming in 1 to 2 times a month, or anytime you really want to go shadow or work with them, they'll kind of make the time to help you just kind of grow in a different area. You know, and I think the last thing is just we just got a contract with the LA Kiss, and I might be able to help out with that. And again, just like the Sparks thing coming up. So, you get so many different experiences and so many different sports. And if you want to focus on a certain sport, you can do that. So for me, the focus was I wanted to do a little bit more with baseball, and I wanted to do a little bit more with basketball. So, I was able to kind of structure my time, my free time, which there is very little of, around pursuing those activities. So, Tuesdays I'm always doing extra stuff with the college baseball guys, and I had an opportunity to kind of work with the Angels PT to kind of see some of his guys and kind of see how he did his rehabilitation, which is just a unique experience because there's always a different way that these experts do it depending on the sport and the demands of it and the political aspect of the professional sports. So if you don't see it, it's kind of hard to understand it, but I think that's what's kind of unique about all of our residencies. We get to see different sides to every level, and it kind of helps shape our beliefs and what we would kind of do in those situations. I think we all kind of agree that residencies are pretty demanding, and I wanted to quickly touch upon just what potential applicants should kind of keep in mind when deciding if a sports residency is right for them or not. So let's just go ahead and choose 1 or 2 things to kind of talk about really quickly with each of us to kind of help these applicants decide if a residency is important or right for them.
With regards to specifics to the sports residency, you got to make sure you're going to love, like what Sean said, spending those late nights, early mornings, in the training room, and helping out with the various sports. So it's a time commitment, and just being aware of that before you get in there is going to be pretty important. And also just organization and time management skills. I mean, it's a lot of work, and your free time's limited. So kind of tooling your schedule as best you can to making sure you're getting the most out of the residency is going to be optimal.
Yeah, I think everybody would kind of agree that the work that we do doesn't. It sometimes feels like work, but the majority of the time it's more fun. We always joke about how we never have that much free time and everything like that, but I guarantee you all of us wouldn't trade any of this experience for anything else. And I think that there's something to be said with that, and you have to really have a passion for it. You gotta really like what you do. You gotta like the environment that you're in, and I think the other thing that's really important is that you have to be kind of quick on your feet. You have to be able to adapt your schedule if something else comes up, or you have to be able to react quickly when you're on the sideline, or when you're treating an athlete and things aren't going the way that you were hoping, and you got to have that reactivity, that adaptability, and I think that's huge in sports medicine and sports physical therapy alike.
Yeah. I would say that if you're considering a residency, it's really important to identify basically what your long-term goals are. Figure out what's really important to you and how that'll kind of lead you down which residencies to pursue, because they all have the same core components, but they're all very, very different, and emphasis may lie a little bit more on certain things. So starting early and talking to a lot of the directors, kind of figuring out as much as you can, talking to previous residents. I know I got a ton of emails just already throughout the fall and the winter asking about specifics about the residency, people coming to visit. And I think that's a really great way to really understand what you're getting yourself into. You can kind of carve out time to go visit and make that personal step towards getting to know people involved in the residency, seeing if you fit in, and finding that right fit. That's what everyone basically said when I was looking for a residency, and it's really accurate, because if you go on a couple of interviews or make some visits, you'll see that everything's very different, and you really need to hone in on what those goals are and kind of find that right fit for you.
Yeah, I completely agree. I think you guys hit the nail on the head with first understanding the time commitment that you're going to be undertaking. So really liking what you do. I would encourage people to do a lot of shadowing, volunteering in athletic training room settings, on field, just to know what you're exactly getting into, because you will be getting a lot of that experience. One of the things I've really learned a lot is my interaction with other professionals, so especially athletic trainers, physicians, coaches, things like that. I guess, learned the hard way sometimes. Maybe early on you don't handle things as well as you could have, but the TCU staff has been great about working with me and helping me to kind of learn and grow that way. So the more experience you get before you start the residency, I think the better off you're going to be. And like Chelsea said, talking to past residents, talking to directors, understanding the personalities and the dynamic of that certain residency, because it's got to be a good fit for you. You're spending a lot of time, and really knowing what you're getting into and making sure you can make that residency kind of fit your goals and what you want to get out of it.
I don't think I can add too much more to that. The only two things I'll say is you got to have passion, I think. Most importantly, if you don't have passion for that particular subspecialty of physical therapy, you're going to struggle in the residency. So, you really got to have a strong passion for sports physical therapy, and definitely what Sean was saying with understanding the dynamics of an athletic training room and being in a team environment is important. So making sure you have passion, and then making sure you can accept criticism well. That's the biggest thing. And I think even no matter what you do, it's hard to prepare yourself for that, but you have to have a mentality that criticism is going to help you grow. So passion and criticism is the only thing I can really add to that. And we kind of just touched base on this, but maybe one more thing to kind of walk through is if you had one suggestion for a potential applicant, what would you say to them?
For me, it's be well informed. We already talked about this. Like Sean said, you got to know what you're going to get into. So contacting the residents. I mean, that's what we all did. We made sure that we knew what we were getting ourselves into. So for all the future and residents, get in touch with us. Get in touch with the new incoming residents, and making sure that this is what's going to fit your personality, and it's going to fit your or where you want to take your career. So that's what I say is probably the most important thing.
Yeah, I agree with Joe. I think that's big, but kind of Sean alluded to this earlier. I think I think the biggest thing you can do is observe an athletic trainer. Go to a local high school or college or something like that, and just spend some time just doing that training room observation, even some sideline observation with the games. Get a feel for that, because you do so much of that when you're a sports resident, and you're going to interact a lot with different professionals and different parts of the sports medicine team, and you'll be part of that. But you got to figure out what everybody else's role is and kind of what your role is in that piece of the puzzle. So I definitely go out and get a little taste for that stuff that maybe PT school doesn't always cover. So
I definitely agree with everything that's been said, and I kind of said this earlier, but I would say the biggest thing is going and visiting as many programs as you can, trying to figure out basically how they run, how they work, observing a resident, seeing what their typical day is like, trying to maybe try to carve out a whole day so you can see kind of all the different hats that we wear and all the different people that we go to, and really understanding what it is to be a resident. Just to ask as many questions as you can, because I know I love talking to potential applicants, and I love talking about the residency, and I get really excited. And I think that we all share that passion and are really excited about what we're doing. So definitely don't hesitate to talk to us.
I think that's all really.
We lose them again?
Yeah.
Teaching, the clinic time, the on-field time. I would try and incorporate all those. And then once you're there, just having a lot of energy, a lot of passion, and taking advantage of every opportunity. We're all given so many opportunities to do different things, so saying no to anything I don't think is a good idea, because you can always get something out of it and learn about what you want to do, and it can potentially shape your career. So just being open to everything.
Yeah. I agree with everything everyone said, and I think the only thing that I would add is make sure you just go above and beyond during your free time and get as much experience in every aspect possible. If you think you've done enough, you probably haven't, so make sure that you just kind of use that free time and do as much as you can between shadowing and getting more experience. So let's go ahead and just wrap this up with one final question. What kind of future do you see for sports physical therapy, and what would you hope that sports physical therapy kind of evolves into?
For me, I would like to see the SCS kind of be accepted a little bit more widely in the sports medicine field. I know it's kind of still in its infancy, and not a lot of people recognize what it's worth. So I think that eventually, moving in the direction of working alongside these people in the sports realm, and getting the respect as sports physical therapists to be able to treat as part of the team in the acute setting, I think is kind of where I want to see this go in the future.
Yeah, I'd like to see the sports physical therapy kind of carve out their own little niche for each other, kind of like what Joe was talking about. Have that SCS carry just a little bit more weight, and I think unintentionally, I think sometimes orthopedic surgeons will look to us as kind of these rehab techs, and in the sports medicine model has kind of been the head athletic trainer and the orthopedic surgeon, and now with the sports physical therapist and with the primary care sports medicine docs, I think that that puzzle is expanding. I think it's kind of a win-win for everybody. So I'd like to see us as sports PTs start to take on a little bit more of the challenge that is sports medicine, and really integrate ourselves into the sports medicine team.
Yeah, I definitely would piggyback on that answer in saying that I think it's a really exciting time, and I think that sports medicine team is really going to be a major difference that's going to evolve over time, adding us into that team, basically showing everyone how we are an integral piece of that puzzle and how we are different from athletic training and a lot of education. I would say kind of being in the Division I setting, it's a little less widely accepted to have a PT in that environment, but I think that it's definitely kind of going towards that, and more schools are now seeing the utility of having that sports physical therapist on board. Athletic trainers do an awesome job at what they do, but the volume sometimes is too much to really give that individualized rehab care to all the athletes. So I think that that's our role in that environment, and I'm really excited about where that's going.
Yeah, I would completely agree with all those things. I think we're starting to see, you know, in the NFL and other sports, PTs are being part of the medical team, and I think that's exciting for us. So hopefully, with our SCS, you know, going through residencies, we can fit into that team, really respecting what athletic trainers do, physicians do, and kind of carving out our own niche just to give the athlete the best care. Because I think there's definitely a component we can offer on top of, you know, what the other primary care doctors and athletic trainers are already doing, and really making us the experts and just having one more piece of the puzzle to get the athlete back out there.
Yeah, and I think I agree with everything that everyone said, and that's kind of my hope as well, that we can kind of help split the volume, as Chelsea said, between the athletic trainers in more of a team setting or a collegiate setting. Especially if you look at these bigger team sports like football or baseball, where you have lots of athletes on the team, and the workload alone is a lot. So they have the model now in baseball. They have quite a bit of PTs that are starting to be on staff. NFL has that new collective bargaining agreement with having PTs on staff in the future, and I think to see basketball or some of the college and universities start to employ PTs would be a nice step, and hopefully something like that in the future will come along.